Hey, it's Reed Magnum with Magnum Media, visiting with Sara Horras, orthopedic physician assistant with SSM Health in Baraboo. And something, Sara, you and I were talking about is there's a nervousness that people can have. Maybe it's injections and needles, or it's they don't want to be pressured into a situation. What are some of the things you tell your patients when they have that nervousness to relax? What are some of the things you take them through in that process?
Yeah, I mean, that's a definitely common concern that I get from people. I do a lot of injections to help with painful conditions. And a lot of times people are coming in saying, "Hey, I've heard that this is really painful," and that limits them from getting treatment that can help them. And usually 9 out of 10 people say, "Hey, that really wasn't so bad." And sometimes I say, "Hey, why don't you come back another day? Bring your spouse or bring a friend, something that's comforting to you, so that you feel more prepared and not pressured into this." And I think that definitely helps people a lot. Um, Sometimes people feel like they meet with us or they meet with a surgeon, they're already committing themselves to a surgery, and that's definitely not the case. I think you can meet with them, gather more information, call back, schedule another visit to revisit. So I think those are all helpful too, just knowing that you don't have to make a decision on that first visit.
And the other thing too, Sara, that I've really learned from you in these discussions, there's multiple pathways. It's not one size, certainly not one size fits all, but even for someone, I know you can lay out multiple options for people depending on what they think they're comfortable with and how quickly they want to progress, or the pace they want to go with.
Yeah, a big thing too is I like to really give people options. I don't want to tell them that they have to have an injection or they have to have surgery for this. I say, "Hey, this is what you have. These are your options to treat it, and then what you want to do is really up to you." And I'm just trying to kind of help guide you and make an informed decision. Just because you have something torn on an MRI doesn't mean you have to have surgery for it. And I get a lot of people that come in thinking like, "Oh gosh, I don't want surgery," and this is what they're thinking they have to have. And so, educating them and saying, "Hey, no, you don't necessarily have to have surgery. These are the pros and these are the cons." So that's definitely a big part of my visits, and just trying to educate people to make more informed decisions.
I'm sure you appreciate the people that do all the research and they come in and think they know exactly what's going to have to happen. But I would imagine your recommendation is talk with you, let you
Yeah,
assess
I
some things
mean,
first.
yeah, we get a lot of people certainly go to the internet and look things up. They talk to their friend or their neighbor, and it can be helpful to just kind of have the baseline knowledge of what their problem is or their diagnosis is. But yeah, it can also be misleading, and definitely still recommend you go and talk to us too about those options further.
Don't psych yourself out before you have that initial
Exactly.
conversation. So, Sarah, for somebody, they want to have that conversation. Maybe they're not ready yet, but they at least want to have a conversation to learn more. What's the best way to make an appointment with SSM Health Orthopedics in the Baraboo area?
Yeah, they can call us at 608-294-6464, or you can log on to our website, ssmhealth.com, search for orthopedics, and enter in your zip code, and you can find our information there.